Welcome. We are here at Birmingham City University, and I'm here with Dr. Mohammed Hossain, who's a lecturer in the Department of Public Health. Mohammed, I and other colleagues, we are doing research together focused on NHS Health Check. So let's hear more from Mohammed about this project. Mohammed, welcome and thank you for your time. Let me ask you a quick question. What is NHS Health Check?
So NHS Health Checks is a nationwide free health checks to see whether you have any significant risk. So it's for certain age group, for example, 40 to 70 years old people. It's not that someone is ill to wait for check. It's like a free health checks to see is there anything that can be prevented earlier by doing this check.
Right, and we say that this project is funded by the Birmingham City Council. How important do you think that such projects are helping the communities?
So this, as you said, this is funded by Birmingham City Council. It's very important. The reason is the uptake of NHS Health Checks is very low within the ethnic minority community groups in Birmingham. As you know, that Birmingham is a very diverse group. More than 55% people are from ethnic minority groups, and the research and the previous NHS Health Checks shows that, for example, from 2022 and 2023, the Birmingham City Council invited 90,000 people to do NHS Health Checks. Only 30,000 took the opportunity.
Okay.
So you can see only 1/3 took the opportunity. So that's why they need to understand why this uptake is so low and what can be done in the future to improve.
So this project that you are leading, and we are all part of it, as a co-applicant or co-creation of it, are we working or are you aiming to work with the diverse communities and trying to get the understanding of what is the barriers, potential barriers to the communities, the diverse communities, or is it focused on specific community?
So it's focused specifically diverse ethnic minority. For example, as you know, that we've been working with 11 ethnic groups, but at the same time, we're also looking at the mainstream group, for example, white British groups. We are also looking at some European group, for example, Romanian group. So just to see how it compares with the ethnic minority groups with the other.
Like to compare the findings, like the barriers, the facilitators, the challenges they're facing, make that comparison. What do you hope to achieve from this project?
So we, as the previous studies conducted by University of Cambridge, and is one of the findings they found, the reason the uptake is low is not only in Birmingham, but it's all over the reason is they found that is the lack of knowledge and awareness of NHS Health Checks. So within the community groups, we wanted to find out whether they are aware of this NHS Health Checks, which is free, and if they are aware, why they are not taking this opportunity? Why 60,000 missing out? And is there anything can be done is there anything that can be commissioned by the Birmingham City Council or NHS that can improve the future uptake?
So let's say you have the findings, you write the report, you can publish the findings. What would be then the potential implications of this project on the diverse communities?
So as you know, that the problem is as a wider public health, what we face that there are, preventable death. The people is, there's people who died below 70 years. And there are many reasons that can be prevented.
Right.
Now, if they take these NHS Health Checks, for example, the major diseases like heart disease, kidney disease, diabetes, strokes, these are the NHS Health Checks part of they do this kind of test. So if they go for it, and if there are any issues, after doing the test, that can be prevented.
Right. Okay.
So in that way, the wider future implication for NHS, NHS spending a lot of money, and that can prevent, for financially, it can be improved. Also, overall health of the minority community, that will be improved. Also, the future generation, because we are also including the people who are approaching NHS Health Checks.
Right.
So it will be wider.
So overall, if I understood correctly, this project hopefully, once it's completed, it could inform future policies, also could potentially inform the NHS approach towards the diverse communities, and also could help individuals live healthier lifestyle by taking the NHS health checks and the likes of them to live in a much more healthier way.
Of course, because as you can see, as you know, that we are from the university, Birmingham City University, but Birmingham City Council, is the government funding.
Yes.
So they're working with NHS. So the future policy, the policy makers, they will be able to know what needs to be done based on this research, and so that they can implement the findings and put them into policy.
Absolutely.
So that can, of course, improve our future.
Well, Mohammed, thank you very much and good luck with everything that you do.
Thank you very much.
Thank you.